Prime Minister Dickon Mitchell highlighted the urgent need for reform in the financing of Grenada's healthcare system, stating that without such changes, substantial improvements in the sector are unlikely. His comments come in the wake of mounting public criticism regarding the quality and accessibility of healthcare services on the island.
I want us to appreciate it's going to require a number of changes. The way in which healthcare is financed. The current system is that, like everything else, there's taxpayers, funds which the government collects through taxes, and then you have a budgetary allocation that says the Ministry of Health. And so we, to a large extent, therefore, healthcare is free. And because it is free, it means whether you could pay for it or not, you get it free. And so we have to get to the point where persons who can pay. And therefore, we have an additional means of funding the payment of healthcare.
Explaining government's recent agreement with the Mount Sinai health system based in New York, Prime Minister Mitchell said the primary objective is to elevate Grenada's healthcare system to meet internationally recognized standards. This partnership aims not only to enhance local healthcare services, but also to introduce best practices and advanced medical technologies.
What we have first agreed to do is to enter into an agreement that allows them to do a gap assessment, a gap analysis of the current challenges that are at the hospital, because we want them to come in and say, we've looked at your system, we've interviewed your management, we've spoken to your staff, we've observed your operations at the hospital, these are your challenges, these are our recommendations for beginning to immediately improve that. And I know each person who goes to the hospital and each person who has a family member who goes to the hospital will welcome such an initiative because it's coming from an internationally recognized brand. So that's step one. Step two, we are saying for building the new hospital, we want to assure the public that quality care will be delivered. And that assurance is going to come from having an international partner who can operate with us to help us manage the system.
Additionally, the Prime Minister proposed the idea of viewing healthcare as an industry, which includes exploring the potential of medical tourism. By positioning Grenada as a destination for health-related travel, the Prime Minister believes the country could attract foreign patients seeking quality care, thus benefiting the economy and improving local health services.
So we want medical tourism. How do you get medical tourists to come to Grenada? You have to offer them a service. I'll take a simple one. Let's take cosmetic surgery. That they will feel confident and comfortable to come to Grenada to do. When people travel, they tend to be adventurous. So whether it's a butt lift or a tummy tuck or something with their face, they are more likely to do it. What better place to do than Grenada? With your waterfalls, with your beaches, with your serenity, with your peace, with your love.
Environmental conditions are conducive for that, yeah.
But to do that, you need to have a healthcare facility that can deliver that and deliver that at international standard.
Reporting for GBN News, I am Beverly Telesford.